Thank you, ladies and gentlemen. We will call to order the House Insurance Subcommittee to order. It is Tuesday, March 2nd of the year 2021. Shelley, will you please call the roll on the mic?
Representative Subcommittee. Here. Representative Hicks.
Here.
Kumar. Lafferty. Mitchell. Here. Rudder. Here. Smith. Here. Terry.
Here.
Thompson.
Here.
And Chairman Hawk.
Thank you. I am here. Thank you very much. The chair detects a quorum. Thank you very much for your attendance. We do have a calendar before us, but before we begin, does any member have any personal orders? For the record, Chairman Lafferty has just joined us, so thank you very much. Chairman Kumar was previously in a meeting and will be here shortly. So, any personal orders from any members? All right, we will start. Once again, we do have a calendar, and we'll go straight through. We begin with House Bill 516. Leader Gant, you are recognized. You have a motion. I detect a second. Leader Gant, feel free to give us a breakdown of your legislation, please, sir.
Thank you, Mr. Chairman and committee. This bill, and I'll try not to bore you all to death here, but I'm going to try to summarize this bill in a way that gives us a quick description. And if y'all have any questions, we can go into that. This deals with legal services plans, and consumers who join a legal services plan pay a fixed monthly fee and have access to an attorney who can answer legal questions and provide basic legal services like preparing a will. These plans are an important resource for working families to obtain access to affordable, quality legal services. These plans are currently deemed legal insurance, even though they do not assume any risk like traditional insurance policies. In 1989, Tennessee Legal Insurance Act was broadly written and did not anticipate changing technology that allowed for certain affordable and consumer-friendly legal plans that are different from legal insurance plans. This bill, all it does is it will modify the definition of legal insurance in the Tennessee Legal Insurance Act to exclude non-insurance-based legal service plans. And I know that's probably confusing, but hopefully that's a good summary. If y'all have any questions, I'll be glad to answer any questions.
Thank you, Leader Gant. Any questions for the sponsor? Seeing none, question is called. All those in favor of sending House Bill 516 to full insurance committee, please signify by saying aye. Aye. All those opposed, please say no. The ayes have it. Your bill passes to full committee.
Thank you, Mr. Chairman and committee.
Thank you, Chairman. Leader Gant, you are also recognized on item number 2 on our calendar, House Bill 523. Leader Gant, we have a motion. We have a second. You're recognized on House Bill 523.
Thank you, Chairman. This bill deals with assignment of benefits for property and casualty insurance policies. It keeps the status quo on existing insurance policies and claims handling. The General Assembly established public policy on assignment of benefits for health insurance, but has never spoken on the issue for property and casualty insurance. This bill does not dictate that property casualty benefits can or cannot be assigned. It affirms that unless the General Assembly establishes a public policy on assignment, the insurance contractual terms are valid. And Mr. Chairman, if you will let me do so, I just need to read something into the legislative record, the history that goes with this bill as well, if you don't mind.
Please do. You're recognized, Leader Gant.
This bill is not intended to affect any right that a person may have under existing law to make an assignment of proceeds which are owed to that person by a third party. For example, an accident victim may receive services from a chiropractor rather than paying for the services at the time the patient receives the services. The patient may sign a document assigning the chiropractor a portion of the proceeds of any later settlement with the third party or person at fault. The settlement often is paid by that third party's insurance company. This bill is not intended to abrogate or alter any existing rights, nor to create any new rights of the right of an accident victim to make such an assignment. thank you for your indulgence on letting me read that into the record.
Thank you,
With
Leader
that, I'll
Gant.
answer any questions.
Thank you. Any questions from any of our members? Seeing none, the question is called. All those in favor of sending House Bill 523 to full insurance committee, please signify by saying aye. Aye. Anyone opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Chairman and Committee.
Thank you much, Leader Gant. We will now move to item number 3 on our calendar. House Bill 461 is brought to us by Chairman Reedy. Chairman Reedy, you've had a long day, and happy if you need to take a breath, come before us. We're glad to have you in front of our committee.
I appreciate you, and I'm always ready for the fight. It's House Bill 461, of course, it pertains to our ground ambulance providers, and I appreciate the gentlemen who are with us today in support of this. And there's certainly
motion and a second on
an
the
amendment
legislation.
that makes the bill, sir. And the draft number is 3843.
That is correct. And members, you've been sent the amendment. It is in the dashboard as well. We have a motion and a second on the bill, House Bill 461. We have a motion and a second on amendment number 1, drafting code 003843. Motion and a second on the amendment. Any questions on the amendment? I think it's just a technical correction that
Well, yes, sir, it's
with
just
a
a
date
date change.
technical correction for us there. Thank you very much. All those in favor of placing amendment number 1 on the bill, please signify by saying aye. Aye. Anyone opposed, please say no. The ayes have it. The amendment on the bill, and we are back on House Bill 461. Chairman Reedy, thank you very much for recognizing the gentleman with you in the office, in the audience who have been proponents of this legislation for several years as we've been running it. So thank you very much. You're
And
recognized.
Mr. Chairman, with that, I tried to count up, I guess this is our 5th year me carrying this for them. And at this time, with your permission, I'll read into the record exactly what this amendment, what this bill will do.
Thank you. You're recognized.
So Amendment 4843, which makes the bill for House Bill 461 and changes 2 dates within code to extend the ground ambulance assessment to June 30th, 2022. The ground ambulance assessment was created several years ago to help fill the gap between the expenses incurred by ambulance service to perform a transport and what Medicaid reimbursements for this transport. Without using any state dollar, the ground ambulance services pay into a fund that draws down over $20 million in federal funds that is paid back out to the services based on their Medicaid transports. House Bill 461 is amended, will extend the ground ambulance assessment for another year. Mr. Chairman and Committee.
Thank you, Chairman Reedy. Any questions of the sponsor? Seeing none, the question has been called. All those in favor of sending House Bill 461 to full insurance committee, please signify by saying aye. Aye. Any of those opposed, please say no. The ayes have it. Chairman Reedy, your bill goes to full committee. Thank you. We are now on item number 4 on our calendar, House Bill 992 by Leader Love. Leader Love, we have a motion on your bill, and we have a second on your bill. Leader, you are recognized, sir.
Forms of treatment for sickle cell disease and services for enrollees with the diagnoses of sickle cell disease that are eligible for coverage under the medical assistance program. The purpose of the annual review is to determine if the available covered medications, treatments, and services are adequate to meet the needs of enrollees with a diagnosis of sickle cell disease and whether the Bureau should seek to add additional medications, treatments, or services. And I apologize, I'm not sure if I had my mic on earlier, Mr. Chairman.
I think we heard you. We're not going to make you go back and reread that
Thank you.
for posterity's sake.
And for those who may not be aware of what sickle cell disease is, normal red blood cells are donut shaped and flow through the bloodstream very flexibly, but sickle cells are just that, shaped like a sickle. And they get sticky, and oftentimes they get stuck in the blood vessels, and they don't carry oxygen to the various organs. As a result, oftentimes patients experience pain episodes, and it's very difficult for them to find a relief for this pain. So this simply says that, again, TennCare shall conduct an annual review of treatments out there and report it out.
Thank you very much, Leader Love. Chairman Terry, you are recognized.
Thank you, Chairman. And I want to thank you for actually bringing this bill. I had a meeting with somebody previously, and there's some treatments that are potentially out there on the horizon for sickle cell. And my questions have been, what are we paying now? What's here? And then if something comes out, can it be more cost effective for us to treat patients under TennCare with any of these new treatments that are coming out there? Vaso-occlusive crisis is a major problem with, and when they get admitted to the hospital, the pain medicine. That, in fact, one of my discussions on this issue has to do with the pain medicine that a lot of people that have sickle cell, and if we have new treatments come down the pike, can we get them off of opioids or whatever treatments that they've had? Because a lot of times when these patients go into an ER, people think they're drug seeking, and they have a higher tolerance because they've been treated. So again, I commend you for bringing this. I'm looking forward to the results. Thank you.
Thank you.
Thank you. Any further questions or comments from committee members? Chairman Kumar, you are recognized.
Thank you, Mr. Chairman. Thank you, Representative Love, for bringing this. Once the reports are generated and they look at the current treatments and so on, who are they sent to, and then what is the follow-up on it? Kindly draw it for us, how those reports will lead to improvements.
Recognize Leader Love.
Thank you for that question. So Section C says, when conducting the annual review required by the section, the Bureau of TennCare shall solicit and consider input from the general public with specific emphasis on attempting to receive input from persons or groups with knowledge and expertise and experience in the area of sickle cell disease treatment. And then on January the 15th, 22, and on before January 15th, each year thereafter, the Bureau of TennCare shall submit a report to the chief clerks of the Senate and the House of Representatives for distribution to the appropriate subject matter committees and to the legislative librarian that details the Bureau's findings from the annual review. So we'll get it and also be available for the general public.
Well, thank you for doing this. This is a devastating condition, and improvements are definitely needed.
Yes, sir.
Thank you again. Thank you, Mr. Chairman.
Thank you, Chairman Kumar. Any further questions or comments? I'll echo the comments, Leader Love. Thank you very much. I know when we were dealing with the opioid legislation that 4 or 5 years ago now, it's hard to believe it's been that long, but there were exceptional moments in time given to the consideration of sickle cell patients and their treatment therein. So we've had broad discussions about that as we look toward innovations, treatment, and hopeful recovery.
Yes, sir.
So looking forward to getting this report, and thank you to TennCare for agreeing to do this. We appreciate the sentiment very much. Any further questions or comments?
May I commend you, Chairman, on the music that was playing when you were giving your final words.
We travel with background music.
appreciate that.
It just kind of plays like birds singing
Yes, sir.
behind me some
Yes,
days.
sir.
So I don't have to pay a thing for
Yes,
it
sir.
either. So
Yes, sir.
thank you so much. Yeah, the question has been called. All those in favor of sending House Bill 992 to full insurance committee, please signify by saying aye. Aye. Anyone opposed, please say no. The ayes have it. Leader Love, your bill moves forward to full committee.
Thank you, Mr. Chairman and committee members.
Thank you very much. We do have a fifth item on our calendar. It is House Bill 767. Not only is it a good bill number, it's a great airplane as well, I think, possibly. Chairman Kumar, that's the attempted humor in the insurance committee that I attempted right there just for you. It was a good try. We are working on some amendatory language on this piece of legislation that has not been perfected just yet. We've got a couple of items. This is going to be, as we discussed in a full insurance committee this morning, this is going to be our Insurance Modernization Act that we're working on with the Department of Commerce and Insurance. So we are going to request that this bill be rolled a week as we work on some amendatory language. Seeing no objection on that, House Bill 767 will be rolled. Any further business to come before this subcommittee? Thank you all so much for being here. I will recognize an adjournment.